Good evening and welcome to the COVID-19 vaccine response and the Native American Community Town Hall. My name is Dustin Jansen. I'm the director of the Utah Division of Indian Affairs and will be your moderator tonight. We would like to say a big thank you to our community partners, the Utah Division of Indian Affairs, the Utah Division of Multicultural Affairs, the Urban Indian Center of Salt Lake, and the Utah Navajo Health System. This town hall conversation brings together Native American community members and leaders that have been at the forefront of the COVID-19 vaccine rollout. These experts will share how our communities have responded to the vaccine and the incredible efforts undertaken to make it available to Native American communities across the state. Tonight's exceptional panelists include Marie Smith, Christina Groves, and Ryan Ward of the Urban Indian Center of Salt Lake, Sean Begay of the Utah Navajo Health System, and Jacob Crane is a community member and executive director of the Salt Lake City Air Protectors. Our panel will be followed by a question and answer session. Guests can ask questions by commenting on the Facebook Live video or entering questions in the question and answer box on Zoom. Staff will monitor the questions and we will make sure they are presented to the panelists. If we don't get all the questions, we will follow up with a post on the Utah Division of Indian Affairs Facebook page. Thank you again to our panelists and partners for joining us this evening. First, we have representatives from the Urban Indian Center of Salt Lake to share their thoughts on how the center has been able to perform outreach engagement with community members to receive their vaccine. We have Executive Director Marie Smith, Christina Groves, licensed social worker and therapist, and Ryan Ward, Cedar Point Health Program Director. Marie Smith is a Navajo, and he currently serves as the Executive Director for the Urban Indian Center of Salt Lake since spring of 2019. Mo uses his running as a way of life to maintain balance and harmony. Over 30 years of career experience in the nonprofit sector with Native healthcare, sports and wellness, and social and entrepreneur programs in Native and tribal communities across Indian country. He has 2 grown kids and 4 grandchildren. He has family that lives in the Navajo reservation near Tuba City, Arizona, and is very connected to the community as well. Their lifetime goal is to complete 26 marathons by the age of 75 years. One of his great mentors was Eloise Cobell, also known as Yellowbird Woman. She was a tribal elder and activist, a banker, rancher, and lead plaintiff in the class action suit Cobell v. Salazar. This was the groundbreaking lawsuit that challenged the U.S. government for mismanagement of trust funds belonging to more than 500,000 individual Native Americans. Christina Groves is Ute, Hopi, and Chinese. She graduated from the University of Utah with a BS in sociology and a Master of Social Work. She is a licensed clinical social worker and has worked at the Urban Indian Center of Salt Lake since 2008 as an intern, contractor, and staff in both the Cedar Point Wellness and the Red Mesa Behavioral Health programs. Since fall of 2019, she has been the director of the UICSL's Behavioral Health Program. She says, "My family always taught us to give back to our community, and working with Native people has always been my goal. Working with Native clients has helped me see the need for meaningful treatment in our community, as well as the ways that mainstream substance abuse treatment and mental health therapy do not always work for our population. In my work, I have been able to understand the significance of culture and spirituality to Native clients and the importance of holistic approach to health and wellness." We also have Ryan Ward. He is the health program and clinic director at the Urban Indian Center of Salt Lake. He has worked at the Urban Indian Center of Salt Lake since 2015 in a number of roles and became health program director in 2018. He enjoys working at the Urban Indian Center organization and developing the clinical services there. He is originally from Washington State. Ryan came to Utah during a Master of Public Health degree at the University of Utah. He currently lives in Midville with his wife, Carrie, and 2 sons. Maurice, could you give us an introduction to the Urban Indian Center? What is the organization? What is the organization's mission?
Yes, hello, and welcome everyone. First of all, I want to say thank you for this opportunity. Yate, my name is Maurice Mo Smith. I'm the Executive Director of the Urban Indian Center, member of the Navajo Nation. I think the appropriate way to really bring light to our conversation today is sharing our mission, which is profound given this time and day and age related to the pandemic. And our mission is to serve the people by honoring Native cultures, strengthening health and wellness programs, and cultivating community. Uh, we we have over 40 years of history in the community of the Greater Salt Lake. Many members of the community know the agency better known as the Indian Walk-In Center. In the early 50s, most natives resided in their territories, their tribal communities, reservations, and due to circular migration, education, economic development opportunities in urban settings, through a designation through Congress, there was funding to set up access points in healthcare and community centers in urban and communities. The Salt Lake City is one of those communities that initially started off as a resource and outreach and referrals for natives to come together, to socialize, to powwow, to come together and celebrate who they are and who we are as Native people. And then Title V funding expanded that opportunity to create greater access to healthcare. When you look at the trust responsibility of the government, healthcare is essential, and holding the federal government to that trust responsibility is still to this day an ongoing fight as Native people. The Urban Indian Center is part of the ITU within Indian Health Services, and that's Indian Health Facilities, Tribes, and then Urbans, which is also known as Urban Indian Organizations. With that said, our primary programs are clinical services, primary health care. We have a behavioral health and mental health programs. We've expanded from our outreach and referral to limited services. We have wraparound cultural programs. Our program named Sacred Paths Family Programs is well known in the community. I invite listeners to visit our website, which is www.uicsl.org. And I also invite you to download our new app. Just go to the Google Plays, download your apps. I know the younger generation, I don't have to explain what that looks like. And download our app so that you can receive ongoing notifications of services and programs, especially related to the COVID crisis. There's within the website, there's a tab called COVID Resources. We provide critical resources for our members and that have identified as Native and reside in the metropolitan area. We provide some relief, critical services. So we invite you to go visit our website, download our app, and that way you're up to speed on the changes in notifications. For example, this weekend we were supposed to roll out the Johnson & Johnson vaccine, but for those that are familiar, that there's been a pause by the FDA and the CDC. We are still administering the Moderna. So this weekend, we have a huge vaccine event from 9 to 1. This is a good time if you're a tribal and Native American within the community to contact us and to register to receive a vaccine, which is the Moderna, which is still considered 97 to 98 efficacy, along with the Pfizer vaccine. Again, www.uicsl.org and download our app. Thank you so much.
Thank you, Maurice. Ryan, what has been the vaccination process at the Urban Indian Center, and what highlights can you share with us?
Hi, good evening. I'm just honored to be here and to talk a little bit about our efforts to bring the COVID-19 vaccine to our community. So, as Mo had talked about briefly, It was back at the end of December that the Urban Indian Center of Salt Lake was able to get Moderna COVID-19 vaccine from the Indian Health Service. We initially offered the vaccine to our frontline healthcare staff at the Urban Indian Center, and then have gone through phases of offering that vaccine to first our elders in the community, and then to our essential workers and people who are most exposed to the possibility of contracting COVID-19. So bring us to today. We're offering telehealth services. We're offering COVID testing, and now we're offering the COVID vaccine to any adult who's 18 years and older. And it's really been great to see that people have been receptive to that, and that they have been able to come and get vaccinated and have some of that, that fear and that weight lifted from them as they've been able to be protected and to be vaccinated. If anyone wants to get vaccinated at the Urban Indian Center of Salt Lake, they can just simply call our main number, which is 801-486-4877. And they would schedule an appointment to get vaccinated. Right now, all of our vaccine clinics are by appointment only, but we have plenty of available vaccine and slots. Currently, we do vaccine clinics during the week on Tuesday, Wednesday, and Thursdays. And then about once a month, we hold a weekend event, like Mo mentioned, that this Saturday, April 17th, we'll offer the vaccine as well.
Thank you, Ryan.
Welcome.
Christina, in your experience as a therapist, how have you been able to help people find safe spaces to share concerns about the vaccine and COVID-19 in general?
Yeah, if we move through the slides to the Red Mesa slides. Perfect, right here. So go back one, yeah. We actually worked really hard in our agency to be able to provide services both through telehealth and in person. So that was one of the biggest adjustments that we made. Previous to COVID, we were not offering services on a regular basis by telephone or by video conference. And so that is something once we reopened, that we were able to offer. So currently all of our services can be offered throughout both. We added crisis counseling. And so, we understand that dealing with all of kind of the stressors and the concerns and the worries, both for our families and our friends here in the city and at home, maybe on the reservation, sometimes carrying that around has been really difficult. So we offer crisis counseling. We still offer our other services, individual counseling and group counseling. We were also able to hire a full-time case manager. So kind of managing some of the everyday worries that people are experiencing because of COVID restrictions, because of maybe having to isolate or getting sick with COVID. We've been able to have a case manager here on site that can help people either by telephone, in person, or through Zoom as well to try to access services and different community resources. And then we also offer support for domestic violence survivors, for people who've been thinking about suicide or experienced suicide, offering support and treatment. And then one of the other things that we had to really think about was, for our Native people, being together and being connected to our community is really one of the ways that helps sustain us. And during the lockdown and with these different restrictions, it's been really difficult. So we've had to move a lot of our community services online. And so some of the things that we've offered in February, we had a virtual powwow, which is the first time we've offered something like that. And then next slide. We also back in September offered another virtual event, the Hope for Life Day. So we had a workshop and some presenters, Patrick Willie and Abraham Thomas, who are members of the Native community, share their talents and also share their own experiences reaching out and asking for help and trying to stay connected. And then coming up, we have this hoop dance workshop that we're offering April 21st and the 24th. So registration for that is open until the 15th, which is tomorrow. So if there are Native youth that are interested in this, you can check out our website or our social media to register for that as well. Thanks.
Thank you, Christina, for that information. And I had heard that when people go in and use your services and get vaccinated, that they actually get sent away with a parting gift. Can you describe what that is?
I can do that, Dustin. Yeah, we just want to make sure that our clients go away and have something to take home with them. So whether it's a face mask or a sage bundle, some medicine, some resources and things like that. Yeah, we definitely think that's an important part of having people come and get vaccinated. So yeah.
I think that's really good, and it really shows your connection to the urban community here. And I know that it's really special for the people that I've come in contact that have used your services. They feel really good about that, and they really feel like you care and are really touching base with them. Who is eligible to receive vaccinations at your location?
Yeah, Dustin, anyone who is American Indian or Alaska Native can register with the Urban Indian Center of Salt Lake to get vaccinated. And currently, because we have the Moderna vaccine, it's available to people who are 18 years and older. We've also just recently offered the vaccine to household members of our American Indian clients. So if you have household members who maybe are not American Indian but live in your household, they can also come and get the vaccine at the Urban Indian Center.
That's great. I think that's going to be really helpful. Thank you very much, Maurice, Ryan, and Christina. Thank you for that help. And if you could just stay ready, I think towards the end of this, we're gonna entertain questions from those that are listening. And next up, we have Jacob Crane, who's going to share his vaccine experience. Jacob is a citizen of the Tsuut'ina Nation, located in the province of Alberta, Canada. He is currently the executive director of the Salt Lake City Air Protectors, a nonprofit organization dedicated to serving Indigenous people in the state of Utah. Jacob is also the board secretary for the Urban Indian Center of Salt Lake. As a social entrepreneur, Jacob enjoys building startup companies that positively impact Native communities. Like many, he wishes to see more conscious tribal investment for future generations, which also creates platforms to build stronger, robust Indigenous communities. Jacob, so you had a chance to receive the vaccine. What was the process like for you to receive the vaccine, and what can you share with those that have not yet received it? Just what can they expect?
Thank you, Dusty. Dada Nistada, Sizit, Jacob Crane. Hello, everyone. My name is Jacob Crane. My experience was pleasant, very professional. I got a phone call from the Urban Indian Center, from the staff there, to register to get my Moderna shot. The folks down there at the Urban Indian Center were extremely kind to me. My experience there was great, wonderful. I'm actually more scared of needles than I was the actual vaccine. So it was a great experience, though. The staff there were wonderful. It was painless. I got a little tired, but that was about it. Like most people that have been talking about their COVID-19 vaccinations. So nothing too special on that side, but yeah, it was great. It was really good. And what you can expect is just to get a phone call from the Urban Indian Center. If you are registered with them, they have some good people reaching out, doing a lot of outreach within the Native American community.
Thanks, Jacob. Hey, what What do you hope to do, or what have you been able to do, or what do you feel more confident in doing since you've received the vaccine?
Well, I feel like I've been able to live, kind of go back to normal. But of course, I've been wearing my PPE to protect myself, and so that's kind of what I do. What I thought of when I got the vaccination is just another way to protect myself. So I feel a lot more confident in public spaces now, and when I'm going to the grocery store and doing the essentials like work and all kinds of things like that. So yeah.
What would you say to people who may be on the fence about getting the vaccine?
I would just say to, take the proper precautions and like what everybody's been doing the last year, wearing PPE, protecting yourself. And this is just another way to protect yourself and, the people around you. And so I would always say to, to do that. And I think it's to be a good relative is to get vaccinated.
I appreciate that. Thanks, Jacob.
No problem. Thank you, Dusty.
Next, we have Sean Begay from Navajo Health System, and just to share his vaccine response highlights. Sean is a public health director for the Utah Navajo Health System. He holds a public health degree from BYU and a Master of Public Administration degree from the University of Utah. His team and other departments within Utah Navajo Health System have directly responded to the COVID-19 pandemic. Their work includes case investigations and vaccination efforts on the Utah portion of the Navajo Nation. And we'll just ask him to share his experience in vaccine outreach within his organization. Sean, thanks for being here tonight. And just a quick question: what has been the vaccine process with the Utah Navajo Health System?
Well, first of all, thanks for that introduction, Dusty. By way of Navajo and everything, when we introduce ourselves, we say our clan and everything. So Sean Begay Inishia, Tuheglini Nishle, Tani Bashachin, Hashkishin Dashachedo, Tkatnizani Dashanala. That's who I am. And so you're asking about the vaccination process within the UNHS systems here. First of all, as many of you might have known, like the Navajo Nation was one of the hardest hit places within the US. A lot of COVID going around and a lot of people not really understanding what was going on. At the beginning of this whole process here, I had visited a lot of the chapter houses trying to let them know, that we don't know a whole lot about this thing, but the likelihood of it, coming to us is very small. And then soon thereafter, everything kind of hit and it was labeled a pandemic. So as far as that goes, most of our residents here on the Navajo Nation live with extended family. And so the likelihood of transmission was very high. We actually did receive our first batch of the COVID vaccine towards the end of December, and that came directly from the Utah Department of Health. We didn't know which, vaccine we were going to be getting. Obviously, we know that Moderna or Pfizer, those were the two that were approved at first. And as we know with the Pfizer, that, required a deep freezer and everything. So being on the fence with things, we didn't know exactly what we were going to be receiving. And so our administration, team with good leadership, we were proactive about that. We ordered a deep freezer ahead of time, just in case we received that Pfizer vaccination, that we wouldn't be left, high and dry. We did receive that. And then soon thereafter, we did find out that indeed we were receiving the Pfizer vaccination. But we were the only facility, in the southeastern part of Utah that had that deep freezer. And so that kind of put us in a good, position to be able to store this vaccine and everything. Prior to that, we were prioritizing who would receive the vaccine. So obviously it first went to the essential workers, in the workplace. So a lot of the healthcare people, the doctors, the nurses, the screeners, those who work directly with patients. And then once we got them taken care of, we rolled it out to the more or less the elderly. I believe it was 75 plus. And we went through our electronic health records to determine which patients fit in that category, and would, advertise that throughout the area. Those who fit in that category, elderly, were welcome to come into our facilities to get vaccinated. And so that process is, we had various clinics set up in Montezuma Creek, which is our, UNHS headquarters. We had vaccination drives over in Monument Valley, as well as in Blanding. Navajo Mountain, which is our furthest clinic, we actually had the provider, go out and administer that to their patients out there. And so that was kind of like the process that we had right there. And it was very clear, the process that we needed to follow through the Utah Department of Health as far as that tiered process. And so we would follow that along with the Navajo Nation. On top of that, we did have more or less like weekly calls, quite often with the Navajo Nation with this vaccination rollout. They were very motivated to find out which facilities were vaccinating their population and everything. I believe they started administering theirs towards the middle of December, where we started, towards the end of December. But, we were very happy, like in the outreach, the outlook with the population is just, very, very grateful for it, like looking forward to it, just due to the sheer fact that, the COVID rates were pretty high in our area right there. So once we fulfilled that, we went to the essential workers, and that included like people like the school district, like the utility people who go out and work out in the, bring power to like the residents out there, oil field workers, post office people, police, and the police force and the firefighters. So all those like pretty much fell under the essential workers. And we didn't forget about those who fell under that exemption with chronic diseases as well too. So those who, fell under that category, we were able to vaccinate as well too. And so after this vaccination and everything, after more or less getting together and understanding how we were going to roll it out, it was pretty much our whole team, at UNHS that was able to do this. We had a flow, if you will. The first one was a little bit, tricky because this is the first time we did that. But afterwards, the process was a lot smoother after that. Everybody came together, everybody had a job to do and everything. And, the caveat is that after they received their vaccination, they actually had to wait for like about 30 minutes. And the reason for that is if there was any kind of like adverse, I guess you could say, effect, we had like EMS on standby and everything. And so if there was hypothetically any kind of like issues, that we could respond to that. There were some, but very minimal. And needless to say, everybody left, essentially like unaffected by it. But yeah, we did have those precautions in place. And, most recently we did have like some FEMA people with the government come to help out with that rollout as well too. So that was very beneficial. I think our UNHS system, did a very good job at rolling out this vaccination process.
Thank you. I haven't heard anything but positive things coming from the people that have contact with your office, with your organization, and the job that you're doing. Sean, who at with UNHS, who is eligible to receive vaccinations at the locations where you're offering them?
So at the beginning, we had that tiered process and everything. But as we found out that we were, fulfilling that category, we opened it up more to the general public. As of right now, we're actually vaccinating a lot of San Juan County residents, current UNHS residents or patients, I should say, and IHS beneficiaries. So it doesn't matter which state they're in, but that's the priority that we're looking at. Prior to that, we were seeing people from, as far north in Salt Lake City that would come down for their vaccination. And so needless to say, we wanted to keep more or less like the administration local and everything, and not have people drive all the way over here just for this, event and everything. And so we limited it, to those three categories right there.
Sean, what has been the community response to your services being offered?
The community response has been very great. Obviously, we're here to serve, patients and everything. Needless to say, other people would pretty much come to us for their vaccination, be it they live in our service area or not. We received, patients from New Mexico, from Colorado and from Arizona, and so from various IHS service facilities that really wanted to come here to get our vaccination. One thing that we're trying to figure out is like who exactly has been vaccinated. Obviously, people have the freedom to choose where they, go for their care and everything. We had some of our residents who have been vaccinated in other IHS service areas, be it in New Mexico or Arizona. And so we're looking at trying to reconcile that information to update our records to find out exactly, who has been vaccinated. Our goal is to get this vaccine into many arms as we're able to within our service area.
Thank you, Sean. Thank all of you who are on this panel. And I'm going to ask all the panelists if they could please turn on their cameras. And I'm just going to ask questions to all of you, and you can respond how you'd like in whichever order you'd like. I am getting questions on the question and answer prompt here, and I think one of the first questions that I'm going to ask this panel is, and this comes out of Cedar City. It says, how are you advocating to tribal members that don't believe in the vaccine? What educational materials are you providing? I'll just open that up to anyone right now.
Hi, this is Ryan from the Urban Indian Center. One of the things that we have been doing is asking the people who are patients who come and get the vaccine if they're okay with having their photo taken, so that we can share that on social media, so they can have the opportunity to sign a photo release. And with some people, we've been able to do a short video and maybe ask them about why they got the vaccine. And some of those, especially elders who've come in and people who are well respected and well known in the community, we feel like that's been a good opportunity to do that and then share that on our social media and Facebook and things like that. And so that's been one of the things that we've hoped will help people see that, their neighbors and relatives and friends are getting vaccinated, and that it will hopefully kind of alleviate some of that fear.
Thanks, Ryan. Sean?
I think in our area, Dustin, Navajo Nation was one of the hardest hit, areas here. Within our population, a lot of people have this familial bond with one another. I think that people in one way or another knew someone, intimately who had passed away from COVID and everything. And so the threat was real and everything. I think a lot of people within our area were motivated to get it, just for that sheer fact, that there's this unknown disease, and if there's a way to prevent that from happening, to end up, just another casualty, then that was something that, they were willing to, look at.
Mo, did you have a comment?
No, I didn't. I
Okay.
think pretty much echoed what Ryan had to say about personal testimonies from our Native elders who have been reluctant to take the flu shot, but the COVID vaccine, it saves lives, and this is something at a whole nother level. So we were really fortunate to identify some elders in the community and young people to tell their story and provide a testimonial.
Thank you. Another question, and Sean, you said that you obtained the vaccine through the state, the Utah Department of Health. Did the Urban Indian Center also go through the state to receive that?
Dustin, we received the vaccine from the federal government, from the Indian Health Service. We had the option to go either way, and we figured it was a win-win either from the state or IHS, but ended up choosing to get it from IHS. And it's been pretty seamless. It's worked really well.
Okay. Sean, were there any difficulties obtaining the vaccine through the state system?
No, the state's been very, gracious working with us. They've always kept us in the loop with things, and working with Melissa Zito, with the Utah Department of Health. She's kind of like been our advocate, very, like forthcoming and everything. We did receive that vaccine a little bit later, than IHS facilities. But as soon as we got that, we were able to mobilize and get that into people's arms as soon as possible.
That's great. That's great to hear that both distribution methods were working very well. And considering the communities you serve, the urban communities or the reservation communities, would either the Urban Indian Center or UNHS, do you know what the vaccination rates are per capita in the areas where you're at?
I can kind of answer a little bit of that question, and then Ryan might have some more. But one of the committees that I serve on is a multicultural advisory committee for the state, and so sometimes getting the numbers is a little complex because of the special relationship between the state and the tribes. But so we weren't able to get really great numbers in the last meeting that I was in, but I was able to get some information from Melissa Zito, and she said that after Caucasians in Utah, Native Americans are the second most vaccinated in the state, which I thought was very promising and really exciting to hear for me, because that's good to hear and share with our other community members as well.
That is good to hear. Sean, do you have any of that data, or not at this time?
Not at this time, but as far as like the county data that I've seen and everything, within the the vaccinations that have been administered through UNHS has been quite a bit. Where the population down south is mostly Native American, we've seen a lot more consistency with that vaccination, compared to like the northern portion of San Juan County.
All right. I'll ask both of you, or both organizations, this. What are some lessons learned that you think we should continue and make part of how we do community health work? I'll open that up to both UNHS and then to the Urban Indian Center.
Yeah, thank you for the question, Dustin. That's a really good question. As Ryan mentioned, we have a really strong relationship with the Utah Department of Health. Melissa Zito was mentioned, Jeremy and that group, as well as our IHS Phoenix area office, where our Title V contract is with. And so we had the option, and we chose to go to through IHS just because we felt like we would receive the vaccines quicker. But from a local and a community level, what I observe in my position and in terms of lessons learned, I think when we look at multicultural communities, the Spanish-speaking community, the African-American community, the Native community, the Asian community, community-based organization leaders in health have to come together quickly to caucus, to determine what's the strategy, where are we in the detection, the prevention stage, the treatment, and that didn't happen. And I think we were left out, and we always felt like we were learning on the back end as opposed to the front end. There was inclusivity, but there needed to be some quick, just in this format, as a Zoom format, bringing the leadership together and say, we want to make sure that, and this is extended to our tribal communities in South Utah, but the communication was good via email. That was there, but I just think it would have been more effective to really come together. From March 11th, which I call the domino effect, is when Rudy Gobert tested positive, and the basketball NBA canceled the season, and that's 4 days after 13 of our native girls came in contact with the Utah Jazz, including Rudy Gobert. And there was mass hysteria, panic, there was anxiety, there was a lot of things swirling around. And so we had some lessons learned in terms of how we operate internally as an agency, and accountability and compliance and reaching out to the families. And so we learned a lot of our resilience. And but at the same time, we acknowledge the strong work that we have here in the state of Utah, because there were a lot of other urban programs across the US. And mind you, there's 41 of them and we're one of 41, and we're exemplary. And so if it wasn't for the partnerships with the state, University of Utah College of Nursing, we wouldn't have had the COVID testing and the vaccination. So the partnerships are there, but just, one of the lessons is just maybe coming together quickly in a forum with the leadership. Ryan might have, or Sean may have some other thoughts on that, or Christina.
I think for us, just the same thing as, Maurice mentioned, like great leadership and everything. Obviously, when this pandemic kind of happened, we were hit the hardest down here. We had a person who worked in Monument Valley who lived in Chicharito, Arizona. And that was kind of like the epicenter, for the Navajo Nation. I would say within a circumference of where she lives, it was like about within 5 miles that like at least 8 or 9 people had COVID and had passed away. And so that was very scary. There's this new disease that we don't know what's going on. But through all that, people were looking to us as a health agency to help and everything. Administration, realized that things are, changing and everything. Rather than, force everybody there, they did give us some time to process that, those who felt comfortable, to be there, could be there. Obviously, as healthcare workers, we kind of take an oath to be there and help people and everything. And a lot of people, rally to that and everything. But there were various ones who, were, for various reasons, were unsure about the disease, who were able to take a little bit of time off and process things until this, whole notion of COVID could be understood a little bit more. One thing that I was very impressed by is, we actually provided devices to be able to help, understand, put healthcare in their own hands, if you will. Pulse oximeters, which measures, blood oxygen level in your body, and also thermometers. We actually purchased a lot of those through, COVID-19 funding. And it gave us, the opportunity to be able to educate them with their health and everything. And so have them understand, this whole notion of the levels and everything. If it's too low, that's really bad and everything, you need to get, to the hospital right away. And just do the sheer distance, if you will, on the reservation. Some people are within about 3 hours of the nearest healthcare facility. And then on weekends, some of them shut down. And so we would give them, 14-day monitoring forms as well too, and have them, pinpoint what to look for. And we just felt that was really, beneficial to help them have healthcare put in their own hands and everything. But, through great leadership and everything, these things were able to, be rolled out. We found funding that was able to help, mitigate the cost and everything. So yeah, that's kind of how we navigated this.
I would also say, from a behavioral health point of view, one of the things that I think has become really evident is that COVID did not just affect people's physical health. It affected their social health, their mental health. It affected them, being able to pay their rent, or being able to pay utilities, or, being able to, in multi-generational homes, being able to isolate and not get other people sick. And so I'm very hopeful that, the conversation changes about how do we keep our community, and how do we keep our both individual and communities, healthy, and change kind of that conversation about talking about that. We were very fortunate that we were able to get, kind of carve out some funding and get a couple of donations to be able to address some of those concerns here, but it wasn't enough. And I think that that is an issue that I have seen, both here in the city and on the reservation. I have a really good friend whose family is down in the Four Corners area. His parents, both of them got COVID and survived, but now we have to take a look at, is their home, are they able to live in their home and stay in their home? Are they able to get the, resources that they need in order to, heat their home and eat and keep the lights on, or whatever it is that needs to happen. And so, hopefully taking a look at health in a holistic way is where we move in the future.
Yeah, I can just echo Sean and Christina for sure. I think we learned to mobilize resources quickly. And I remember back, as Mo mentioned, early 2020, we were a little unsure of what our capability was, but I think with strong leadership, we stepped up to the plate and worked with partnerships and brought in the right people we needed, hiring more nursing staff to be able to respond to COVID and test people, and to be able to help them to know, what to look for and how to avoid getting the disease, but if they did, how to manage their symptoms and how to know when they may need to go to the hospital or something. So I think we learned to be flexible. We learned to really maximize the resources that we had and do our best to serve the community.
Dustin,
Oh, go ahead, Mo.
yeah, sorry. I want to add one other thing that comes to thought that really substantiates what I meant by that. What we did, because of when the domino effect happened with COVID on March 11th, a week or two later, we had the earthquakes. So that was trauma on top of trauma. And what we did is we had weekly check-ins, all staff Zoom check-ins weekly on Fridays, to just check in, see where we're at, not just with our work, but emotionally. Where are we? And I can truly say that having that forum really brought and eased the anxiety, and that we were all going to get through this, because there was a lot of uncertainty. So if you take that weekly Zoom talking circle concept and say, with the community leaders that we were all going through this, that would, once every 2 weeks, that would have really bode well, because I didn't know exactly what Sacred Circles was doing. I didn't know what the other community-based circle agencies were doing. We're all in this vacuum, but that might be something in your office that could host and facilitate that in the future in terms of best practices. But the talk, and we will call it the electronic talking circle. Sorry about that, Jacob. I stole your error. Sorry.
That's cool. Yeah, that's something we can totally talk about and see if we can organize in the future. Jacob, I just have a question. Can you, with Salt Lake City Air Protectors, can you describe a little bit of the work that you do? And maybe, I know there's other organizations like yours in Utah and around the country, but how do you feel like your services may have changed based on this COVID-19 experience?
Well, we completely pivoted from air quality campaigns and environmental concerns to straight COVID relief. We restored a community garden out there on the Confederated Tribe of the Goshoot Nation on the western door of Utah. We've made probably about 30, 40 plus trips down with food supplies down to southern Utah, to the Utah Navajo COVID relief program under the umbrella of Utah Navajo Health System. We've driven right down to the headquarters of the Navajo Nation as well. We've provided food as well to the Ute Nation. We've pivoted completely to try to serve the Native American community within the state of Utah. And so it's been a interesting year. That's what I will say. But we're coming out with good spirits, and we're just happy here to support the community in any way we can. So I hope that answers your question, Dusty.
Absolutely. Now, and I'll pose the same question to UNHS and the Urban Indian Center. Have your services changed at all because of COVID-19? Have you changed the way you do things and the practices that you do? And from these changes, do you think you'll keep those changes will be implemented from now on.
I'll say, for the behavioral health program, especially during the lockdown, one of the things that we would get requests from our community members was for traditional medicine, because the trading post here locally was closed for a really long time. And so that was something that we were able to do, that we were able to provide traditional medicine in a safe way. It definitely took a lot more coordination to be able to have a no contact drop off. And then a lot of our services have really been kind of letting our clients kind of take the lead. What do they need? What do they need right now? Right. That there's a lot of processes in coming into our agency, but a lot of our community members just needed to talk and kind of let out some of this stuff that they were dealing with. And so we've been able to kind of provide that listening space, whether it's on the phone or Zoom, or if it is in person, and just kind of, let the client take the lead a little bit more, maybe than we had been in the past.
Yeah. Oh, go ahead, Sean.
I was just going to say for UNHS, yeah, when this whole pandemic hit and everything, the way we did business kind of changed a little bit, obviously we kind of like kept people out of the, facility for the time being and opened up a curbside, service, if you will. And so a lot of the triage and everything was, facilitated outside. We really hadn't experienced this before, but we made it work. Those who needed, to come into the clinic and everything for whatever reason, for follow-up or, any kind of specialty, there was like screening procedures that they had to do. So anybody, before they entered into the UNHS premises would have to verify that they had I guess you could say an appointment there and everything. And that would be verified at the, front with the person standing outside. And then on top of that, when they would come through, the welcome area, there was a temperature gauge right there, so they would go ahead and, facilitate their temperature to make sure that they were within range right there. And also ask, like if they're experiencing any kind of these symptoms right here. If they answered yes to any of that, they were diverted outside, and they would be screened outside and everything. But, prior to that, like we would also like make sure that we were up to snuff with our PPE and everything. Obviously, a lot of unknowns with this disease, so did you have the right N95? Did it fit you and everything? Did you have your visor and everything? Because we didn't know the whole dynamics of this disease, things were kind of like changing. Now that things are lifting a little bit more, and the transmission level has been down within our service areas, we're inviting more people into the clinic and everything. Those screening processes are still the same and everything. And they're verifying that people have, appointments there and all. They're, like discouraging like large congregations within the waiting area. But, like moving forward, we anticipate that, like hopefully we'll be able to open that up to more people, to come into our facilities and all. But that's kind of where we stand right now with UNHS.
I just had one comment to share also about kind of our changing services at Urban Indian Center. We have moved some of our services to be offered via telehealth, whether that's seeing one of our nurse practitioners, or a good example of that is we offer a national diabetes prevention program, which we'd struggled sometimes to get participants in. It's quite a commitment. It's a year-long commitment for this group, but being able to offer it via Zoom, we had people, in Ogden who were able to join, who maybe would have had a harder time driving to Salt Lake to attend the classes. And so it's kind of opened it up. So being forced into some of these different ways of using technology have actually really benefited some of our patients and community.
Yeah, I think even in government we've seen some changes and our part and really have been blessings in the long run because of COVID-19 about how we do things and how to be more effective and efficient in the things that we do. I have a question coming in. do you plan, or do you have a plan with rolling out a vaccine for children, and or what do you anticipate the timelines on that being?
Dustin, this is Sean. So we anticipate, that once FDA approval is given, that we would start, administering that. And that's a question that's been posed, to our providers and everything. Obviously, like Pfizer is approved for ages 16 and up, but as we know in the news, as we've watched it and everything, that, they've deemed it safe, for ages 12 to 15 and everything. So depending on, like the FDA approval, we would start doing that. So yeah.
And the same with Urban Indian Center. Once its vaccine is approved for children, we will be offering it to children as well, and really excited about being able to do that.
I understand that when you receive the vaccine, that you ask those that just received the vaccine to wait for 15 minutes, and I guess to observe them and to see if they have any reactions. What types of reactions have you seen in those first 15 minutes, or have you?
For ours, like there have been some very, like minimal side effects, I guess you could say. Generally, like 15 minutes is the recommendation if they haven't had any like adverse reactions to previous vaccines. But if they, like mark yes and everything, we would have them wait at least 30 minutes to see. But various ones, like we would be in open communication with them. If you feel like your heart, like beating a little bit faster, you feel your temperature starting to rise, or you're feeling a little disoriented, please let us know and everything. And our directive is as they were waiting in the line, if you experience any of those, to honk your horn. Thankfully, we've only seen like a few of them and everything, but we would actually go from, vehicle to vehicle and check with them, how they're feeling. And after the allotted time slot for them to wait, if they felt like they were good, they were free to go. But yeah.
Very similar process at Urban Indian Center, except for our patients are in the building, so not in their cars, but they're monitored for 15 minutes as kind of a minimum. If they've had adverse reactions in the past to vaccines, then we would increase that to 30-minute monitoring. And we always have a provider, one of our nurse practitioners, available to answer questions or to care for someone who's having, some kind of reaction. We've seen just minimal things, a little bit of dizziness with a few patients and things like that. No major adverse reactions from the people who've been vaccinated at Urban Indian Center.
Well, that's really good. I would like to thank all of you for all your work that you're doing, and for taking the time to appear on this panel to share this information, and to to offer that encouragement for people to get vaccinated. And I wanted to, if just to the audience and those listening, if you or anyone has questions about COVID-19 vaccine distribution, updates, or information, you can visit the following websites or contact the organizations listed on this slide. And you can take a picture of it or do a screenshot of it if you'd like, and share this information with those around you, and do your best to stay informed to help keep our community safe. And we'll just leave that there for a few seconds. And while you all are taking down this information, I know we've all been keeping to ourselves to stay safe this last year, and I want to express gratitude for the hard work of the organizations throughout the state and the nation. I express our gratitude for our healthcare workers and the many hours that they've spent trying to keep us safe and help us return to a new sense of normalcy. And I encourage all of us to do our part so that we can see our friends and family again. And I heard a vaccine recipient say, she said, It's been a year since I've hugged my grandmother. And now that we're both vaccinated, I will not take this time for granted as I had been. And I think there's a lot of things that, and as Native people, that we're looking forward to doing again. And the sooner that we can do our part and get vaccinated, the sooner that we can return to our families, the sooner we can visit our friends and to do those things that make our community strong to begin with. At my child's elementary school, right when you walk in the school, written on the wall, it says, "Be kind, be safe, and be responsible." And I think that's so important. And I really hope that we can all do that. But I want to thank you all again, the panelists on this Zoom call and Facebook Live, for taking your time to share this information with us. Please, if you have more questions, just contact the people on the previous slide. And I wish you all a good night. Thank you.
Thank you.